Welcome to this month's LSP regional training session. I'm Dr Mike Mckean. I'm currently a paediatric ST3 in London and part of the London School of Paediatrics Education Committee. So today it's a pleasure to introduce Dr Mckean. Dr Mckean is the consultant in respiratory paediatrics in Newcastle. He's the Vice President for Policy at the Royal College of Paediatrics and Child Health, and he's instrumental in the UK for his work in raising awareness of the effects of vaping amongst children and young people. We also have Laura and Olivia from the RCPCH team who will be sharing their experience of advocacy. This will be a very, very useful session for everyone today, as you'll be able to learn the risks of vaping and how the college and Dr Mckean have been instrumental in advocating for a change in the law. So please do make the most out of it. It will be interactive. Put some questions in the chat. There will be a QR code as well that we've just shared with you all. Just make sure you register so we can ensure certificates are given at the end to all of those who attend. And remember that it can be linked to your Progress Plus outcomes, so domain 5 specifically on health promotion and illness prevention. So make sure you pop the certificate onto your portfolio and do some reflections afterwards. Thank you, Dr Mckean, Olivia and Laura, for joining us today. I'll let you take over.
Thank you for inviting us, Dr Mckean, and hello everyone. So I said I'm a respiratory paediatrician. My name's Mike, and I work up in Newcastle at the Great North Children's Hospital up here. And I have this grand title of Vice President for Policy, which I didn't really know much about it before I volunteered for doing it. And there's a few things we want to sort of hopefully get out of this meeting, which we'll go through in a moment. But before I do, I will invite Laura and Olivia, who I'll have to be really honest here. I sort of sometimes front things in terms of media and policy work that the college gets in front of, but gets involved in. But I must say it's Olivia, Laura, and a few of their friends and colleagues who you all pay for, who are members, and I pay for, and they are absolutely amazing college staff, and they've done all the work on this. So Laura and Olivia, would you like to introduce yourselves first, and then we'll get cracking?
Sure. Thanks, Mike. Hi everyone, I'm Olivia Lam and I'm one of the policy managers at the college, and I specifically look after our health improvement and health inequalities policy work, and vaping falls under this.
Hi, my name is Laura Kennedy and I'm the media manager here at the Royal College. So I focus on all things sort of external affairs and across all of our policy remits, but I have a particular focus on our vaping work.
Fantastic. And I must say, it really has been an absolute pleasure working with Laura and Olivia on this. And I hope we'll give you a bit of a flavour of what we've been getting up to. So I think Olivia's got the slides. If you want to go to the next slide, then we'll tell you a little bit about this session then. And I think it comes under one of your training domains, which is set out there. If you need to fill in any portfolio things. Anyway, what I'm hoping to do out of this session is just to ensure that you're developing your knowledge base around vaping, its risks, and particularly understanding the journey that we've been on, and hopefully it's of some interest to think a bit about what the college has been up to as well with it, so it gives you some insight into what we do and might even encourage you to get involved with the college in the future at some point in your career. We hope that there's some outcomes there that you'll be able to get from this. But I guess what I want out of it is a conversation and with you, and share what we've been doing. But I think also it would be great to know if hopefully this hour will enable you all to have a degree of confidence in raising vaping in whichever sphere of life you're in, but especially obviously in your medical practice as well, talking to parents and talking to children and young people about it. So I'm hoping that this will help inform a little bit. In terms of process, we've got some slides to go through. We've got another 50 odd minutes. I'm hoping to get through the slides in half an hour or so, and we'll have a bit of time to talk at the end. But I'm conscious sometimes things go on. So if you have questions, I've just opened the chat. I'll be keeping an eye on the chat, and if I spot any good questions, I'll try and ask them. And then if we have extra time at the end, if people have burning questions, want to put the hand up, we may be able to do that as well with a bit of luck. Next slide, if that's okay. So what do we do? The Royal College of Paediatrics and Child Health. You all know that. Hopefully a lot of you are members. Maybe some of you aren't members and are thinking about it, or in the early parts of your career. I've been told there might even be one or two old fogies like me out there too who are listening in, who've been members for some time. There's about 22,000 members now, and we have a fairly key role in medical education, obviously, but also setting standards, research and policy. And the research and policy perhaps are the slightly things that people are less aware of in terms of what the college gets up to. And it's a funny old thing, isn't it, when you think about those things, when you think, well, actually the NHS should be sorting all of that out, and why do we pay, and why are we an independent organisation? We're actually a charity, a registered royal charter we have for our charity, which is, it means there's sort of various rules and regulations, but the way colleges are set up is very deliberate, and that is to ensure there is an independence of our thinking, an independence of the standards we set for ourselves, and that we're involved in it, so the standards aren't being done unto us, they're set by paediatricians, and that we have therefore a driving, if you like, role in helping the NHS along its path. But we're an unusual college because we're called the Royal College of Paediatrics. There's a Royal College of Anaesthetists and whatever, but paediatrics and child health, and it was deliberately called that. And it was deliberately called that because the paediatricians who set it up around the before the turn of the century, some fantastic people who thought really hard about it, and the paediatricians who then voted on it back then. When I was what was I doing then? I was a young paediatrician then in my training. And it was decided very carefully to call it that name because we wanted to be not only for like the anaesthetists or physicians or surgeons, we wanted to be there for children's health. And that means we've got a wider remit, which we take very seriously. And of course, one of the remits is health prevention, health promotion and illness prevention. And this is where vaping comes in. It sits with our health improvement and climate change policy teams. Next slide, please. So youth vaping. You probably all know the problem. I'm going to get you all to think a bit about it yourself for a moment, in a moment. And it was really, e-cigarettes came in the market, onto our markets from from 2005, and there are probably, we think now, 4.5 million vapors, regular vapors. There's people who've tried it a few times or intermittently doing it. We think there are now over 3,000 vape stores and many online sellers, and you'll see it in certain supermarkets still, although most of the mainstream supermarkets now are declaring that they're going to sell vapes. But when you saw it in the supermarkets, or if you go into the small corner shops and the mini marts, you might see shelves like that. And I've certainly been into numerous corner shops, and quite often the first thing you see is a big row of vapes, often not behind the counter or hidden away, quite often next to the sweet stall as well. And they look enticing, colourful, etc. And I think it's important for us to understand this growing kind of market that's out there. It's everywhere. Every town, every city has got somebody who's selling vapes. There's very likely an underground or a black market kind of selling of vapes as well. We know that's occurring. Probably it's hard to measure though that, but probably we think to quite a large extent as well. And it's been increasing in numbers as well. We'll talk about that and how things have been developing in a moment. Next slide, please. Before we do that, I just want to make sure you know about regulators, because this is stuff paediatricians, I certainly wasn't really aware of this. But there are some. Our country has legal regulators who are able to enforce, if you like, a regulation, which comes from law. So the tobacco-related products regulation in the UK will really be there for nicotine-containing vapes, as well as obviously cigarette smoke. But the nicotine containing vapes are governed by a different regulatory body called the General Product Safety Regulations, and they don't have as much teeth and specificity to how they can regulate things. That's important to know. And then, but because of all the rising problems and the difficulty in regulation, in 2015 it was passed that you're not allowed now. A law was passed, you're not allowed to sell vapes below the age of 18 years. We might have just lost the slides there. We'll catch back up again. Here we are. And of course, advertising was also at that stage brought in very heavily from 2015. That advertising in a broad sense on the mainstream media was not allowed. So you won't see a lot in televisions about vaping, or and national sort of advertising campaigns on radios and TV basically were banned. And a lot of the advertising that occurs now is on the internet, very targeted and very difficult to manage, and also just very much in local shops themselves. So next slide. So what I'm going to do now is pause before we move on. Where the next steps, we're going to tell you a little bit about the epidemiology of vaping, the growth of numbers, a little bit about the risks, and then we're going to talk about the campaign. How do you advocate to change law, which is what we've been busy doing over the last 2 years or so, 2 to 3 years. We've been really developing a campaign to change the law, and in fact, this might come across the wrong way. It's not meant to come across as tooting our own trumpet here, but without the Royal College of Paediatrics and Child Health's input into that, the law that is still in front of Parliament and we hope is going to get passed one day would not be where it is now. There was an awful lot of pushback, and it took a lot of careful negotiation to get it to the position it's at. So before we talk about those wonderful things, I've got a few questions to pose for you guys, which might stimulate some Q&As if you wish to, and also to stimulate your own thinking, as there's quite a few of you. I won't be out there. Usually when I'm teaching or talking, I usually try and ask somebody, but there's quite a lot, so I won't pick on anybody. But what I want you to do is spend 2 minutes now writing down, if you've got a piece of paper, if you're on the hoof or sitting in a restroom in your hospital somewhere listening in, don't worry if you haven't got a pen, but just lend your brain to it. What do you think is the prevalence of children and young people vaping? Have you got an idea from what you've heard or see in the media, or just from walking down the street? Do you have an idea of how many kids might be vaping? Ask yourself the question, have you ever asked a young person or their parent about vaping in your medical history? And if you have, I want you to try and think back about kind of how that went and be able to think about it. And it might be that's something we can discuss at the end. And finally, if you have asked, if they have asked, has anyone ever asked you about the harms, and sort of said, well, I only vape because I'm coming off cigarette smoking, or my mum and dad are coming off cigarette smoking, or a parent says that. And if they have, what was your response to that? If you haven't asked that, can you imagine that happening if you said, I want to challenge a parent who's vaping in front of their child, and they said this is the reason they're vaping? How would you handle that, and what would you say? So I'm just going to give you a minute, and I'll mute so you don't have to listen to my voice, and then we'll get going again. hopefully you've had a little bit of time just to pause and think, challenge your own thinking about what you would say. And then I'm hoping kind of at the end of the session that outcome is saying, actually, you know, how would you do it in the future? I'm hoping that that might have been informed, and if you're already spot on with it, great. If there's areas you think you can bring into your own practice, then that would be fantastic. I'm going to hand over now, and I think it's Olivia, isn't it? Is going to take you through a little bit about the stats and some of the risks, and then we'll be talking about what we've been doing about it.
Yes, thanks, Mike. Oh, sorry. Yeah, so just going to go through a bit of the data. Hopefully what you see here is what you're kind of expecting in terms of prevalence, and hopefully not too surprising. And I'm also going to cover a bit summary on what the evidence has been telling us about the health impacts of vaping, especially in young people, how young people are accessing vapes, and what is it that's driving this trend on increasing vaping seen amongst young people as well. And then we'll have a discussion how that helped us form our policy recommendations to which we aimed at UK government to hopefully drive change and reduce uptake. So first of all, on prevalence, these figures are taken from an annual survey that ASH England, who are a charitable organisation, and it provides a really helpful overview on the prevalence and trends of vaping. They first did a survey back in 2013, a bit after a while after vapes were available in the market. But we can really see the kind of where the spike started happening. So the 2024 survey this year was based on 2,500 respondents of young people aged 11 to 18. And it tells us that the number of young people who have tried vaping has increased significantly since it was first started, surveyed in 2013, which is at 3.8%. And this has risen steadily to 18% now. But this is a slight decrease from last year at 20%, but still a marked increase from when the survey started. Then those that report that they currently vape have also seen huge spikes in trends as well. We see the rate has doubled between 2021 and 2022 from 3.2% to 6.8%, and that has remained static around 7% in the last couple of years. But there's actually a significant variation between age groups as well, and we see the highest proportion of those who currently vape are 18-year-olds. On frequency of vaping, the biggest increase in regular use, which is those that vape more than once a week, is seen from 1.2% reported in 2021 to 4.2% reported this year. And when we look at how this compares to young people who currently smoke, only 5.1% say they currently smoke compared to 7.2% who report they currently vape. And the majority of the main reason why young people report to vape is that they just want to give it a try and that they like the flavors as well. So looking at how young people come across and access vapes, as Mike mentioned earlier, it is currently illegal to sell vapes containing nicotine to under 18s, but a majority say that they purchase vapes from shops at 48%, and over half said that they're given them. So this demonstrates how easy it is to access vapes. And unfortunately, there's a current loophole where it's currently legal for industry to give free samples of nicotine and nicotine vapes to under 18s as well. Looking at flavours, young people say that the most popular flavour they use is fruit and sweet flavours. And then alongside the flavours, we know that the brightly coloured packaging and these kind of dessert flavours and chocolate flavours have been introduced by the industry, which we know are deliberately used to promote and target young people and appeal to them as well, which is really driving up the uptake. And then around awareness of vape promotion, we can see that awareness of marketing and promotion has steadily increased as well. 55% said that they're aware of vapes being promoted in shops, which is an increase from 37% in 2022. We just wanted to do a bit of a more of a deep dive into disposable vapes because it's very much a huge growing concern for us. So disposable vapes, they are single use and not rechargeable or refillable, and they continue to be the most frequently used device this year at 54%. And this is compared to those only 22% who use rechargeable vapes. But disposable vape use is slightly down from 69% in 2022, but is still significantly higher than in 2021, when it was only 7.7% of young people using disposable vapes. We know that it's the kind of easy access that I mentioned before, but also the cheaper price point of disposable vapes. They're often less than £5 compared to reusable ones, and that's what's driving this youth uptake as well. But alongside that, in 2023, it was estimated that over 5 million disposable vapes were thrown away, and this is a huge increase from 1.3 million in 2023. So even though they're creating this health problems, they're also creating a huge waste problem, as they're often not thrown away properly. And we know that there's no national recycling solution in place that takes disposable vapes. And it's a concern because they contain single-use plastics and precious metals like lithium, which is currently in short supply and are really critical to our green transition, as well as the e-liquids, which contain toxic chemicals that qualify as hazardous waste. So when these disposable vapes are littered improperly, they can leak these hazardous materials into the environment as well. So looking at the health risks now, what we've seen is that the evidence base is only starting to develop, and the focus has largely been on the effectiveness of vapes as a tool to quit smoking in adults, and also the harm compared to tobacco smoking. But we know actually that a lot of young people who vape don't smoke, so it's really important that we separate the evidence on harm's impact of young people from adults as well. We know that nicotine is a very key ingredient in vaping solutions, and regulations are in place on the legal limit of nicotine strengths, but many products have been found on the market that exceeds this, and we know that exposure to nicotine causes health issues such as addiction in young people as well. Most recently as well, the college's research and evidence team have been conducting reviews of studies out there that have been published, so we've been able to get a kind of good understanding of what the evidence is telling us on vaping. So just to summarise here, we know that the evidence suggests that vaping can exacerbate respiratory illnesses in children, that they do act as a gateway product to smoking as well in young people, and vaping can increase risk behaviours such as drug and alcohol use, and there also increase in sleep-related complaints amongst young people. And concerningly as well, members are increasingly telling us that they're seeing young people being hospitalised for vaping-related disorders, but this is still quite in small numbers. So on evidence, our approach has been really about communicating the unknown harms, because compared to understanding the impacts of smoking, which has been around for generations and years, impact of vapes is still relatively new. We don't know the long-term impacts, and it's very limited in evidence base. So our approach has been focusing on an absence of conclusive evidence that vaping is safe rather than safer than smoking. We've been acting on based on these emerging concerns about the negative health impacts, and we'd never promote vaping as a healthy behaviour. So we are really aiming to prevent uptake in young people. So the college's approach to policymaking is generally what we can do to protect young people from any known and unknown harms. And specifically on vaping, we've been focusing on untangling vaping policy from smoking cessation policy for adults. And so based on these growing concerns from our members, what they're seeing and in clinics, also all the data that just summarised earlier, where we've seen the trends of what's helping drive the uptake, and also what we're seeing as the failures to properly enforce the existing regulation and measures to protect young people from accessing vapes. We developed a set of policy recommendations that we've been using to influence UK government with. The first is on implementing a ban on sale and supply of disposable vapes. The next is restricting use of flavours and introducing plain packaging so that they reduce their appeal to young people. We also want to see promotion restricted so they're not on display in store and they're hidden away, like tobacco cigarettes hidden away on display. And we also want to bring the regulation on non-nicotine vapes in line with nicotine vapes as well. So I'll just hand over to Laura now, and she's going to talk through our advocacy work.
Thank you so much.
Just before we get going, Laura, just to say the Q&A function I'm told isn't working or isn't set up. So what we will do is I'll just ask for any hands and questions at the end, because even though there's a few of you, we'll try our best to answer a selection of questions. Thank you.
Thanks, Mike. So on college advocacy, I suppose it's important just to reiterate my role and the wider teams in the college. So as I said already, I am the media manager for RCPCH, and I work as part of the external affairs team. So that means our primary function is advocacy, and we do that through media, public affairs, and sort of integrated communications activities, whether that be social media, stakeholder engagement, and so on. When it came to this work on youth vaping, I think as you can see from the previous slides, this issue started off way back in the 2000s as a very sort of like slow increase in youth vaping, and then suddenly, I think like most things post-COVID, we saw a massive boom. So that meant that in 2002, the college began to take action, and we began to raise the alarm on youth vaping. And we did this through our media activity with a series of interviews with both The Guardian, The Times, and BBC News. I think it's worth mentioning at this time, early 2022, we were navigating quite a pro-vaping landscape. The sort of old vaping is 95% safer than smoking figure was still very much prevalent at this time. I think some of you will have noticed that there's been a real shift away from that figure, which it's now been found out is overstated, but that still kind of remained in the psyche at this time. And we also got considerable pushback as well from obviously the vaping industry, but also some of our smoking cessation stakeholders as well. I think one of the moments that made a real key difference for us was when Dr. Mckean made headline news through an interview with The Guardian, in which he stated that youth vaping was fast becoming an epidemic. This got a huge amount of attention, and I think created a notable shift in how vaping was being discussed. And next slide, please, Olivia. So, as Olivia has already shown you our policy recommendations, I think one area that we were particularly focused on was disposable e-cigarettes. So data shows, and it continues to show, that these products are very much the product of choice for children and young people. We didn't know a huge amount about disposables other than they were prevalent when we started this work, but it was actually through engaging with our environmental charities such as Green Alliance and even the RSPCA that we learned about how detrimental these products actually were when it came to the environment. So that's both in terms of littering, I'm sure you've seen them around, the ecosystem, they're hazardous to animals, they're known to cause fires, and also the sustainability of lithium batteries too. It turns out lithium is a finite resource, and we're putting them into disposable products that are used daily. So sort of based on that information and the unknown harms, we as a college decided that we would call for a ban on disposables. We did this in June 2023. I think this is one of those interesting areas, well, just another one of the many examples of where our work intersects with both health and climate change. So our climate change policy team were heavily involved in this. When we called for a ban, it made headline news. It created a lot of attention. I've put in a quote there from Mike, in which when he talks about disposable cigarettes, he calls them a lose-lose situation, which I really like. Next slide, please, Olivia. So we didn't just do media work when it came to this campaign. There was also a huge amount of engagement with decision makers. So in terms of consultation responses, we responded to many from the government, most notably their call for evidence on youth vaping, and also the policy consultation on creating a smoke-free generation, which we will talk about more. A couple of notable moments was when Dr. Helen Stewart, our Officer for Health Improvement, participated in a health select committee on youth vaping. She gave evidence. This led to the committee lobbying the then government for further action on youth vaping. So it was really great to be involved. Our public affairs team did continued outreach to parliamentarians, briefing MPs ahead of key debates, inputting into Wes Streeting's team and so on. And then there was also regular check-ins with officials at the Department of Health and Social Care and how RCPCH could help push this issue in the public agenda. Next slide, please, Olivia. So as mentioned, the smoke-free generation, it was in March of this year that the Tobacco and Vapes Bill was first announced via the King's speech and then introduced into the House of Commons. Sadly, with the timing of the general election, the initial bill that was in Parliament was lost. It didn't get through the wash-up. But we have commitments from the current government that it is due to return. We're hoping before the end of this year. So the smoke-free generation plans to create the first ever smoke-free generation in the UK. It's going to make it illegal to sell tobacco products to anyone born after 1st of January 2009. So it's a slow phase out of cigarettes. This is just on the pure prevention model, that it's easier to never start smoking than it is to quit. Next slide, please. So while there is a big focus on smoking in the Tobacco and Vapes Bill, the recommendations for vaping, the restrictions on vaping, are pretty much exactly what the college asked for. So that's restricting vape flavors, plain packaging, controls on how they're displayed, outlawing vaping alternatives like nicotine pouches for children, which we know is an issue that's sort of growing, and then also fees for shops, which we know is a big issue for accessibility. And then most notably for us, a ban on disposables. That's going to be taken forward by DEFRA. We see the Tobacco and Vapes Bill as an opportunity to safeguard the health and well-being of our children, but we don't necessarily see it as the end goal. Look at the next slide, please, Olivia. So just to sort of fill you in on where we are today, I think as a result of our work and other organisations operating in this space, there's a much keener focus on the issue of youth vaping and the sort of challenges that it presents. As a college, we are continuing to call for the reintroduction and swift implementation of the Tobacco and Vapes Bill. As I said, we're hoping that this will be back in Parliament before the end of the year, but we are noticing, I suppose, a slowdown from DHSC, and we are keen to keep the momentum going on this. So I would ask that you, as paediatricians, maybe consider writing or emailing your own local MP, as we know those voices, your voices are extremely important in terms of influence and advocacy. Some of you may have also seen that there's been reports that the government is actually looking to go a bit further when it comes to the bill and potentially prohibit vaping in public spaces, such as outside of schools and hospitals. To full transparency, this is something that the college is actively considering taking on as policy proposals. We know that we want to be able to learn the lessons from, I suppose, smoking in the 80s, 90s, and so on, and be able to approach issues like these, new products like these, threats to children and young people in both a swift and robust way. So yeah, we're just keeping the pressure on, I suppose. Thanks. That's it from my side.
Fantastic. Thank you, Olivia. Thank you, Laura. So we'll wrap up and then ask if anyone's got any questions. We've got a bit of time to take any questions, so you can think about that now. So my sort of learning from this is I'm just a jobbing paediatrician, really, to be honest, and getting involved in the college was for lots of different reasons, but for any of you who do get involved in the college, it's very much a voluntary role. But for me, landing in as a policy person, I've been interested in that, and I've done various leadership things up here, and started to realise that, as well as trying to do what we can do on the ground with all the challenges we're seeing for young people and ourselves in supporting them, there is a need also to have a voice in government. And what I learned from this process was that the RCPCH has got an incredibly respected voice. A lot of people do look to us, come to us for advice and guidance. And the second thing I learned is that the college is incredibly careful on how it gives out its advice and guidance. And that sometimes it can appear that we are perhaps sometimes slow, maybe because of that. But believe me, now I know what happens in the behind the scenes, as I say. There's an awful lot of very diligent, careful work done, and it does mean that when we do express our opinion on something, it's usually gone through an enormous amount of thought, and I think people respect that because of it. And certainly, it landed us in this position of advocating against vapes, particularly single-use vapes, and it was quite an interesting process. And I remember with Laura and I sat on a meeting with our colleagues from ASH, and they are a fantastic organisation. The anti-smoking lobby. It's what is it called again? Action for Smoking and Health. So really respected kind of. They pushed a lot of this, but they were very, they tried to lobby me particularly to not call for a ban on vaping, and also members of our some of our physicianly great societies who deal with adults, I guess, with smoking related diseases, again were very much supporting this approach. It was all going to be about cigarette smoking, and they really had no thought about the effect of children. And sadly, we see that too often in lots of policy areas. You're probably all aware of that. And there really is a need for children's voice to be heard. And of course, they're voiceless because they can't vote. But they need people, not only their parents, but us as paediatricians, to advocate for them, particularly around health issues. One example of that is that you mentioned the 90%, 5% safer. If ever you hear that, you've just got to challenge it. That came from again, I bet you it was all blokes, because it's bound to have been. But anyway, a group of esteemed academics, it probably wasn't all blokes these days, but I bet it was mostly, esteemed academics, I think 30 or 40 of them got together when the vaping was sort of early years coming onto the market, and the anti-smoking people said, actually, this could be a great tool for coming off cigarette smoking. And they thought, well, they had to sort of put something out there to say vaping's safe, because they thought it was safe, yeah? So there was no papers, no publications, nothing that decided. They just got together, a group of well-known kind of academics, and said, what should we say? 95%? Does that sound about right? Yeah, 95%. We'll go for 95% safer. And of course, the media picked up on that, and that became set in stone for many, many years. And of course, the vaping producers and marketers just jumped on it, and it just gave us a lesson about how esteemed people, if that's the right phrase, respected people, can actually use their voice both for power, but also for what I think was quite bad. In terms of me as a respiratory paediatrician, I have seen kids vaping, and I do ask now routinely in my practice, do you vape? I'm not sure always that the kids, I do a lot of asthma work. I don't think they always tell me the truth, and perhaps I wouldn't tell an old fart like me the truth as well. I do ask them, I do ask their parents, we ask them separately, and as you get to know a person, actually you can start to work with them, and we do then start to get some answers back. A lot of my asthmatics actually are quite vehemently anti-vaping, but they then go on and tell me their story of being exposed to it in the loos whenever they, some of them who can't go to the loo these days at school because it's just full of vapes, and they do feel it makes them coughing and breathless. I haven't seen anybody with popcorn lung, if anyone's heard about that, although it has occurred in the UK and there have been deaths because of it, but it's fairly rare, and that's because of preservatives in certain vapes before regulations started to come in. But there are illegal vapes out there, and there is still a risk that some rogue seller will put something in it to preserve it that's cheap and starts causing havoc with lungs, and kids and young people, some people have died because of it. But thankfully that's not a huge thing at this stage. Final thing I would say is there has been some analysis done by chemists who've looked at vapes, and there's a big thing to say, you know, if you chemically analyze vapes and compare them to tobacco cigarette smokes, they are much safer in terms of that there's a lot less potentially harmful substances in them. However, this is being challenged at the moment because there is some data to suggest that some of the substances in some of the vapes that are freely available have got the potential to cause quite a lot of harm, including cancer. So there's still a lot of concern out there. There's no doubt, I think, that regulated vapes, though, and if you can find and buy a trusted regulating vape, which is another question, are probably safer than cigarette smoking. And there's no doubt there was a lot of cigarette smokers have come off cigarette smoking and even come off vapes eventually as well. But it causes me great consternation that we have lots of kids now who are addicted to nicotine, who are vaping a lot, some of them starting cigarettes as well, and there is very few services, guidance. You know, if you want to send a young person to an anti-vaping clinic, well, I know of one person in the Northwest who's trying to set one up. We haven't got one up here. I've not heard, there may be some in London. I think there's somebody in London who's trying to do something about it. But actually, we've got a large number of kids who are now addicted to nicotine, who may or may not, but some of them may want to come off it, and it's going to be quite hard for them. So anyway, that's my rambling kind of reflections. We're trying to keep the pressure up because we see it as a big problem that we will, you know, potentially have a generation of kids who are not going to be well served from this. And we don't know what the impact would be if they smoke vape for 20, 30 years, 40 years. What's going to happen? No one knows that yet. And I think we have to be very, very careful and cautious. So I'll end there and open it up for any hands and questions. I'll have to get to the question thing. Hold on a minute. Here we go.
I think we have Olivia Stredder who's put.
Hi, thank you so much. It's a really interesting talk. I just wanted to ask a little bit about the practical aspects of discussing vapes with patients and parents, because I'm an acute registrar paediatrician, and so I'm seeing patients in the ED every day, many of whom are coming in on sort of in very difficult circumstances, many with mental health presentations, or who've been assaulted, or with safeguarding concerns. And these are people in distress. And we do ask about vapes routinely, and a lot of people say that they do vape. But I just wonder, what's your advice about discussing it in that sort of scenario, particularly given that it's difficult to give clear evidence about the harms of vaping beyond, you know, addiction. And I think a lot of people share that view that it's a lot safer than smoking. And I just wondered what your view was on that aspect.
Well, several things. Is it safer than smoking? Actually, the answer to that is no one knows. Nobody knows yet. we might find out one day in 20, 30 years and be absolutely nail it down that it's, you know, it's safer than smoking by this much. But if you look at what happens, what we know about tobacco smoke and what we think goes into a regulated vape, if you were forced to smoke something, you'd vape, you know, you wouldn't take a tobacco cigarette. I think the context in which you tackle it is really important, isn't it? If you've got a young person who's coming in with an asthma attack and is vaping, and even if they are distressed in lots of ways, I personally feel we're not doing a full job if we don't start to get into that discussion. But I think you have to be very mindful of your role and the time and the time that person's at as to whether something has an impact or not. Because I think if you just sort of go in straight into vaping without thinking about the wider context, you might just alienate somebody and might just put them off from having a proper conversation and listening, really. So, and as an acute paediatrician, you'll probably know that better than anybody, I suspect. So the time you have, which is limited, isn't it? You have to sort of think about actually what can I achieve and what's best here. If someone's coming in great mental health distress and they're vaping and they've got a nicotine addiction as well, it might be the last thing on your list to do. That I've got to tackle the vaping because there's many other things to achieve first. And this is where it gets a problem, doesn't it? This is what the NHS, I think, we struggle with, and perhaps could all of us do a bit better at in terms of how we work within systems, because sadly we don't have great access to anti-vaping advice and guidance. The college is putting some out now, but in terms of having people, professionals, or somebody who could talk to them, there are anti-smoking services out there that if you're organised enough and can work them out, and often EDs are very linked to them now, and you can make referrals and try and engage people with thinking about, or check, write to the GP to see if they can trigger a referral or something. And they have some success if a person really wants to try and stop smoking. I mean, they've got to want to do it. So my first question would be, think about the context and see if somebody wants to stop vaping, then what can we do? But unfortunately, at the present time, the services aren't there and aren't great. So someone who's well established on vaping is going to be really tough. If you have the time, then I think you should get into it, because I think there are some potential problems. And in terms of, is it harmless? No, there's quite a lot of data out now showing it does increase the frequency of cough-related illnesses, and if you're an asthmatic, trips or escalations of asthma treatment. There's data coming out now which shows it does do something. It probably does generate a bronchitis in some people, albeit it might be a mild one for most people. So I think it's probably not completely harmless. We don't know a lot more in terms of what else it's causing at this stage. I don't know whether that's answered it, but and it's slightly dodging the bullet, isn't it? But I personally think you should raise it if you have time. But equally, you've got to think about your context. For me, in my asthma clinic, if I've got someone who's coming to me for the next year or two, and I'm going to be seeing them every 3 months or whatever, I can start getting into it and drip away at it and start having more in-depth discussions about either their parent or themselves, and try to start thinking about how I can support and advise them. I think it is trickier in an emergency department.
Thank you. That's really helpful. If somebody is maybe not at the right point to give up, or they're not ready to give up, what advice would you give them about regulated vapes, how to make sure the vapes are the best quality or the most regulated they can be?
I may not have the best advice for that myself, except please don't buy it from somebody on a street corner for a start, because you don't quite know what on earth they're vaping. Go to a registered shop. But even in some of the shops, they are selling unregulated vapes. There's unscrupulous people out there who will just sell the cheapest thing they can get hold of. And the problem is the regulators don't have an army of people to go around and check, and they haven't really put this as a priority to this stage. We're hoping the changing law will make this a real priority, and that they will have a little bit more teeth, therefore, for dealing with unscrupulous shop sellers, but I would suggest that they make sure that they're buying from a registered shop. And I would say to them, you know, really this is potentially going to be a big risk for you in the future, and you really should seek some advice on how you could cut down on your vaping. I know we say go and see your GP. Poor old GPs are just kind of inundated, aren't they? But they really should be prepared to have conversations, or if they're under paediatricians for other illnesses and follow-up, you know, it can be flagged, and can we start supporting them and trying to encourage them to think about coming off vapes? I think, Laura, you've got something to say about that.
Yeah, I think I can help with this question in a little bit. Obviously, you're right, unregulated products are often being sold in corner shops, but one thing that people can do if they are concerned about the product that they have bought, e-cigarettes are also regulated by the MHRA, so all regulated vapes for UK markets should have an ECID number that would be available to see on the packaging. So they should be able to see on the outside on the cardboard packaging, if that's helpful.
Thank you.
Good questions, Olivia. Thank you. I wish I had a simple answer like that. Say, you know, send them to here or send them to there. We don't yet have those services available. Unfortunately, they may have to grow because nicotine addiction is growing in children, which is a bit sad to see. Any other questions? I think there's, is it Bryony?
Hi, my name's Bryony. I'm a general paediatrician. I had a patient a few years ago who I looked after him when I was being a neurology registrar, who'd had a cardiac arrest following vaping cannabis. And there was it was very interesting, kind of a safeguarding thing, the general feeling everyone had about how she'd been doing that. She'd been a bit related to my colleague from UCLH's question about, you know, people in crisis. She'd been in a terrible sort of mental health crisis, and she'd actually been, after a bereavement in the family, she'd actually been smoking cannabis with her dad, and then had started vaping cannabis with her boyfriend. And it's not something I've seen kind of published much about, or people discussed about the risk. And my just one-man job is, whenever I'm sort of doing a full heads assessment, I really, you know, emphasize people mustn't vape cannabis, and that, you know, that is spice, and it's a whole different kind of kettle of fish to cannabis that people's parents might have smoked in the 70s or 80s. Is that something, you know, is that a one-off that I saw, or is this a kind of a concern as well that people have and the college have?
Well, I've heard of some of the cardiac effects from cannabis, and there is data out there which can back all of that up. I'm not seeing people or hearing lots of noise about people using, you know, could you use vape machines and start putting cannabis in them? I have heard of it being done, but I'm not seeing lots of evidence coming out on that, other than at meetings people saying, like you, we've had somebody we know who's been using a vape machine to take very, very large doses of cannabis and other drugs, other inhaled drugs as well. So I suspect people might be playing with machines and using them in all sorts of ways. But I don't know whether Laura, Olivia have heard of similar things. I'm not aware of any big data on it yet.
It will be hard to find data on it, but I do know that it is a question that we get asked by journalists quite a lot. So it seems that there must be quite a lot of anecdotal reports of this happening in order for, say, journalists from like the Times and so on to get in touch with us. So I imagine that's not an isolated incident at all.
And I think, sorry, I was going to say, I think it's more frequently seen in the States as well, because some states have legalized cannabis use. So I wonder if we are going to start seeing data from over there, and it's often that what we see in the States happens is like we follow shortly after. So definitely one to keep an eye on.
Yeah, we will keep an ear. It's a good tip. We will keep an ear out for it. And you know what? The other thing is, children and young people, and just human beings, but children and young people especially, are really good at experimenting, aren't they? And we don't want to take that away. You know, we have been accused occasionally of being sort of a bit big brotherish. You know, you mustn't do this and you mustn't do that. And I don't think we as paediatricians want to necessarily feel like we're that. We're not the police. We don't want to be part of the police state. We're in the UK and we stay in the UK because we value some of the freedoms we have very much so. And we don't want to give that away, but neither do we also want to see our young people being abused. And if you see the way that marketing's occurring, I mean, a few weeks ago, I can't find the picture. Someone sent me a picture of a vape they've found at a shop in the deepest Durham minefield somewhere, coalfield somewhere in one of the Durham towns, at a vape shop. And it was, you know, people get kind of, you go to, I don't know, whether it's McDonald's or whatever, you know, and you get a milkshake in a very colourful bottle with a straw on it. Someone had marketed and produced a vape that you sucked through the straw, and it had really colourful kind of, like, it was a really colourful milkshake. And it was clearly targeted at little children, probably very young children. And you know, so there's all sorts of oddness that, and children, when they see it, will experiment. And older children, if they are getting involved in other drugs, probably will experiment. So I think it's a difficult thing to do, isn't it? But yeah, we have to be aware of it, of people smoking cannabis and other drugs, inhaling other drugs through a vape machine. It's quite worrying, really. That's a good question. Any other questions? If not, we will wrap up in a minute.
I think it's 2 o'clock as well now, Dr. McKean. So I think a few people are starting to leave, but thank you so much. If there are any final questions from anyone, please do pop them in the chat. I think Sabira sent them as well in the chat, which looks quite useful for everyone to have a look at afterwards. I'd just like to say thank you very much for such a fantastic session today, and for your time, Dr. McKean, Olivia, and to Laura as well. It was very, very useful, and I'm absolutely amazed by how much work you all have done in raising awareness of the risks of vaping and are still doing, and advocating for children. Thank you everyone for attending as well today. So an email has been sent with the feedback form, so please complete this to get a certificate. Everyone should have the link already, and then there'll be a recording available on this MS Teams chat for anyone who missed the beginning of the talks. I think quite a few people started to come in later on. And then Dr. McKean's also kindly agreed for us to have this published on our YouTube channel, so thank you for that, and I'll organise for that to happen, and then everyone can access it on YouTube as well. Thank you so much.
And thank you very much for inviting us, and take care everyone, and thank you.